This is the anatomy of the lower body. So we'll start with the foot. So on your foot is your transverse arch from the mound of your big toe to the mound of your small toe. Transverse arch. Your lateral arch is from the mound of your small toe to your heel. So going down this way is your lateral arch. On the inside, from the mound of the big toe to the heel is the medial arch. Okay, that is the medial arch. So we use these arches when we are creating our pada bandha or our foot lock. Pada means foot, bandha means lock. So if we just stand up for a moment and do that. So if you put your feet on the mat, pick up your toes, you will see that the mound of your big toe is on the mat. Then place the mound of the small toe on the mat and slowly put down your toes, curling in your toes or holding them on the mat, gripping them on the mat, creates a lock called the pada bandha. While we are standing up, we can see the anterior tibialis, which is on the front of the shin. So just on the side, on the front, is the anterior tibialis. And the anterior tibialis is responsible for the dorsiflexion of the foot, which means that you bring your toes towards your knee. That is the dorsiflexion of your foot. And you will feel that muscle on the outside engages. Okay. At the back of our foot is the soleus muscle, and we're able to engage the soleus muscle by plantar flexion, which is standing on your toes. So when you're standing on your toes, you can feel the muscle at the back, the soleus muscle working, not on the whole thing, just at the bottom. Yes. At the back is the gastrocnemius muscle, and that muscle is responsible for flexing the knee. So flexing the knee, the gastrocnemius muscle is responsible for that. Let's talk about planes of movement. So we just did flexion of the foot. This is extension. So flexion, picking your foot up, and extension is down. When we move our limb away from the body, it is abduction. Moving your limb away from the body, moving it towards your body is adduction. So away from the body is abduction, and towards the body is adduction. One more movement of the lower body is the inversion, moving your foot towards the midline, and eversion, moving it outwards or laterally. Okay, so the planes of movement that we learned is abduction, adduction, flexion, extension, inversion, and eversion. Okay, let's go back to the muscles that we learned. We learned the anterior tibialis here, at the back the soleus muscle, and then the gastrocnemius muscle. Good. Let's sit and we can learn about the rest of the muscles in the body. The lower limb and the top of your thigh is your quad muscle. So all together it's called a quad muscles, quadricep muscles. It's made up of 4 important muscles. The big one on the front is the rectus femoris muscle, right on the front. And that is responsible for the flexion of your knee. No, your hip flexion, sorry. Your hip flexion, okay? The big muscle here. The muscles below the rectus femoris is the vastus intermedius. Vastus intermedius. It is directly below the rectus femoris muscle. On the outside is the vastus lateralis muscle on the outside, and on the inside is the vastus medialis muscle, and this is responsible for knee extension. Okay, so basically bringing your knee up. So the muscles on the outside will cause knee extension, and the rectus femoris muscle will cause hip extension. At the back are your hamstring muscles, and this is made up of three main muscles. The big muscle at the back is called the bicep femoris, and it's made up of two other smaller muscles, the semitendinosus and semimembranosus muscles on your hamstring. On the inside of your leg are the adductors. The inside, the adductors, yes, just there. And going from your hip across to your knee is the sartorius muscle. Okay, so your hamstrings are responsible for, the big muscle is responsible for knee flexion. So here at the back, if we stand up, the big muscle at the back is responsible for knee flexion, and the smaller muscles on the side of the hamstring is responsible for hip extension. Okay, so again, the big muscle is responsible for knee flexion, which is like this, and the smaller muscles on the side is responsible for hip extension. Okay, then on the side, just attaching here at the top of your pelvis, going down on the side is your tensor fasciae latae muscles, and they are also responsible for hip flexion. So bringing your foot forward, causing hip flexion. On the side also, another big muscle that is on the side that causes hip extension, so moving your muscle, your leg back, is your iliotibial band. So let's just bend down and go over those again. So the big band on the side here is your iliotibial band. Then your tensor fasciae latae is also from your hip down the side. And then we have our butt muscles, which are made up of three muscles. So the biggest one is the gluteus maximus muscle, which is responsible for hip extension and rotation. And deep below this glute max muscle, which is here, is the glute medius and glute minimus muscle. And this is responsible for hip flexion. So the medius and the minimus are responsible for hip flexion, okay, which is moving your leg forward, right? When it's, so if we stand up, we can do this action. So hip flexion, we will be using our glute medius and glute minimus muscles here, deep below the glute max muscles. The glute max muscles allow us to cause hip extension, and you can feel that in your glute max muscles. As soon as you move your leg back, you can feel that muscle engaging. The other important muscles we need to know, which are the hip external rotators. And when I sit down, this is externally rotating our hip, and the muscles that allow us to do this movement are called the hip external rotators, and there's four muscles. They are deep inside here, so we won't be able to feel them, but we know they attach from the pelvis. Okay, they attach the pelvis to our femur, so the top part of your big bone here on your leg. Okay, that's what causes us to be able to move that out. And there's four important ones there: the piriformis, the obturator muscles, the quadratus lumborum, and the missing one. Let's try again. Piriformis, obturator, quadratus lumborum, and the gemelli muscle. We missed one, gemelli. Okay, those are in your hips here. Your psoas and iliopsoas are other important muscles deep inside here, which also allow movement of our hips. Okay, and we will get to that one, and those allow our hip joint to flex. So when we like move backwards, we can flex those psoas muscles, and we'll do that with various poses, right? So the important muscles in the hips, let's try them again. Piriformis, gemelli, obturator, and quadratus lumborum. Then the two that are here are the psoas and the iliopsoas muscles. If we move up here in our abdominal muscles, we've got at the front the one right on the outside is called the rectus abdominis muscle. And right below the rectus abdominis muscle is the transverse abdominis muscle, okay, which engages to the function of the abdominal muscles is to allow our spine to move. It allows that movement, right, and to keep us upright. The oblique muscles are on the side, and this allows for rotation, for lateral rotation or flexion. Okay, that these are the oblique muscles here. So let's do some poses that allow us to feel how these muscles work. So since we are sitting, we can sit in Siddhasana or Siddhasana, right? And when we're doing this, we can feel certain muscles working. So our hip flexors are engaging to be able to move our knee down, to be able to keep our legs like this, right? It's engaging our hip muscles. Some of the other muscles that are engaging, we can feel our quads engaging, but our adductors are stretching out. Okay, you can feel that. Okay, so that is the Siddhasana. If we sit in Sukhasana, it's the same thing, right? It engages our quads. At the back, our glute muscles are now stretching, especially our glute maximus muscles. All our glute muscles are stretching to allow us to sit like this. Okay, let's try another pose. So let's try a seated twist pose. So if you take your right leg, bring it over your left leg, hold your knee with your elbow and twist. And now you can feel the twist in your iliotibial band on the side of your leg. Iliotibial band is stretching, right? And also to be able to stretch or to be able to rotate, yes, your obliques, right? So your obliques are working, but on one side it is stretching and on one side it is engaging. Okay, so it's stretching on the side here, but what's happening here? It is engaging to allow you to be able to stretch. Okay, let's do another pose. So if we take our leg and we stretch it out, let's rather do the other side so we can get the full benefit. Okay, so Janusirasana or Parvita Janusirasana. So this is a nice pose to feel the stretch again now. Our glutes are stretching. Okay, our quads are stretching here. Okay, but what is happening to the quad on this foot? It is engaging because our foot is in dorsiflexion. So our anterior tibialis is also engaging on the foot that is outstretched, and so is our gastrocnemius muscle. Okay, so we've got a whole lot of muscles that are engaging, but on this side we've got muscles that are stretching out. Okay, and if we stretch over, then we will use the oblique muscles, and again The oblique muscles on the right are now stretching, but the ones on the left are now engaging. And in order to be able to do this, we are engaging our transverse abdominal muscles deep below the rectus abdominis muscle. Okay, let's come back up. Let's switch to the other side so we can feel that stretch and extension or engagement on the other side. Again, now it will be the opposite way. So we're stretching the obliques here, engaging the obliques on the other side. Stretching out the quad on this leg and engaging all the muscles on the right leg. Okay, let's bring our torso back up. Put our feet with the soles together. Baddha Konasana. Okay, and what are we feeling here? Now we're feeling the adductors on the inside stretching out. You can feel that. And in order for us to be able to do this, our hip external rotators are working. Because now we are moving our feet out, then our rotators are working here. Okay, what's happening to our tummy muscles? They are extending, stretching, yes. Okay, so our rectus abdominis is stretching up. Okay, so that is Baddha Konasana. Okay, let's take our feet, just stretch it out in front. Okay, bend the right foot.
Right hip open.
Bend your right foot, put it under. Yes. Top of your feet is flat. And bring the left foot to go over the right. Putting the top of your foot flat on the mat or floor. Okay, cow faced pose. If we do the arms, then it will be the right arm back, left arm below, cow faced pose. And now what's happening? The rectus abdominis is doing what? Stretching. What's happening on our legs? What's happening to our quad muscles? They are?
I feel weird.
They feel weird. Our quad muscles are stretching out.
And here?
Oh, the tricep muscles, yes, on that hand, are also stretching out, but we're doing lower body, right? So what is happening to our glute muscles? They feel good. They are stretching. Good. And one more muscle that is involved is our hip flexors, our psoas and our iliopsoas. And do you think they are extending, they're engaging, or are they stretching? The muscles that are here.
Engaging.
They are engaging, yes, to be able to put our legs like that. Good. Okay, let's try. Let's switch over our legs. Cow face pose on the other side. Let's stretch out the glutes here on the right hand side now, because we stretched out the left. So we're feeling that stretch here, engaging our psoas muscles, stretching our rectus abdominis to sit up straight, stretching our quad muscles. You can leave the hands because we're doing the lower anatomy. Okay. Let's come to a seated position. While we're here, let's do bridge pose. Okay, so let's lie flat on our mat. Bend your knees, putting the soles of your feet on your mat. Try and reach your fingertips to the soles of your feet. And when you're ready, lift your hips off the mat. Okay. And in bridge pose, we are engaging our glute muscles. We have to engage our transverse abdominis muscles. And now in this pose, we're giving a good stretch to the psoas and the iliopsoas muscles. So instead of engaging them, we're now stretching them. What's happening to our quad muscles? We are engaging them, engaging the glute muscles, engaging the quad muscles, engaging the gastrocnemius muscles also. To be able to keep us up there, we're engaging all the muscles. And then slowly come down. Okay, let's investigate the ab muscles. While we are here, we can do boat pose. Okay, so if we engage all the muscles in our abdominals, the transverse and the rectus abdominis muscles, we can pick up our legs straight up off the ground, pick up the top of the ground, and you can feel that engaging here. If we point our feet towards us in dorsiflexion, what do we feel? We feel the interior tibialis, we feel the quads engaging. And let's go lower to the ground. Rest. Let's do our oblique muscles. So if we are going to engage our oblique muscles, then this is how we're going to do it. Pick both your feet off the ground, bend your knees. Okay. Stretch out your right leg. Pick up your torso off the ground. Bring your right elbow to meet your left leg. And you will feel that oblique muscles working very hard. Let's do the other side. Side left leg is straight, right is bent, and we can reach towards the knee. Good. And let's go down. So when we're doing that pose, the left side, if we're reaching towards the left is stretching, the right is engaging the oblique muscles. Okay? So that was Navasana with a twist. Okay, let's do one more stretch out. So let's go into child's pose. So when we are doing child's pose, we are now giving the body a good stretch. And some of the muscles we can feel stretching are our quad muscles. Can you feel that?
Yeah.
Yes, good stretch on the quad muscles, and stretching out our glute muscles, and stretching out our anterior tibialis muscles. Everything is just get a nice stretch. Good. Let's come onto all fours and pick up your torsos. So you're kneeling. Up, kneel. Right. So we are going to do camel. So put your hands like you're putting them at the back of your jean pocket. Good. And we're going to hinge at our hips, slowly going back. And if we can, we're putting our hands on our heels. Otherwise, we're just remaining here in the bend, just to feel the muscles that are stretching and the ones that are engaging. So here we are giving a nice stretch to the quad muscles. And what are we engaging to be able to go down? The glute muscles. So which means, what are we doing to this rectus abdominis and transverse abdominis? Yes, we're stretching while engaging some of them. Because we have to engage the transverse abdominis to be able to go down, but it's also stretching the rectus abdominis muscles. And come back slowly. Go into child's pose, stretching out again your quads, anterior tibialis muscles. Okay, let's come up. Let's do a few other poses. So downward facing dog is another good pose to feel our stretching muscles. So what are some of the muscles we're feeling stretching here? From the bottom, the gastrocnemius muscles. Yes. The hamstrings are also stretching behind, so the entire back is stretching, and so is our gluteus maximus muscles, all stretching out. Okay, let's step our right foot to the top of the mat, bringing our right hand on the inside of the right foot, coming into lizard pose. Okay, lizard on the stretched knee. Sorry, on the straight leg. On the straight leg, it is stretching out our psoas muscles. Can you feel that here on your hip, stretching that out? But on the leg that is bent, we are engaging our gastrocnemius muscles, engaging the quad muscles, right? And somehow stretching out a little bit of the hamstrings. Okay, let's go back to downward facing dog, stretching our back, gastrocnemius, hamstrings, glute muscles. Let's bring the left leg forward into lizard. Now engaging the muscles on the left leg. So engaging this gastrocnemius muscle, engaging the quad muscles, stretching out the hamstrings on that leg. On the straight leg, we're now stretching out the psoas muscle. But we can also feel a stretch in the quad muscles, right? So one is engaging while one is stretching. Okay, let's walk our foot to the right hand side of the mat, putting our shins on the mat, bringing the right foot onto the mat, pigeon pose. And this helps to stretch our hip external rotators. And what are the 4 important muscles in the hip external rotators? The piriformis, obturator, gemelli, and quadratus femoris. Good. Come up onto your right toes, switch legs. So right leg comes forward. Okay. Good. That's giving a good stretch to the hip external rotators. Let's come back to downward facing dog and up to standing. So you can walk or step your feet up to standing. And let's stand up. Okay, let's do tree pose, Vrikshasana. So you're going to take your left leg, bend your knee, bring the sole of your foot to your thigh. Okay, let's look at some of the muscles that we're using here. The external rotators. You can feel that, the hip external rotators engaging to be able to move the leg out.
And quad stretching.
The quads are stretching. Your rectus or transverse abdominis is engaging to keep you up. In the leg that is bent, we can feel the quads are stretching, but the leg that is straight, the quads are engaging. Okay, the adductors on the inside of the leg that is bent is stretching out. Okay, what else is happening? Your glute max muscle on the leg that is standing is engaging. Okay, let's switch sides. Okay, what is happening now to the hamstring muscles, the semitendinosus and the semimembranosus at the back of the standing leg? Those muscles are engaging. Yes. Okay, and again, now you're stretching everything on this leg. Your adductors, your quads are stretching. Okay, let's come down from tree. And let's go into forward fold. So hinge over your hips. Hinging over. And here you can feel the stretch in your gastrocnemius muscles. Right? Stretching your hamstrings, stretching your glute maximus minimus and medius muscles. Okay, let's come to standing. So that was the lower body anatomy. So let's go through it one more time. The planes of movement: flexion, extension, abduction, adduction, inversion, eversion. Then the muscles are anterior tibialis, your soleus muscle, gastrocnemius muscle, your quad muscle is the big one, rectus femoris, lateral vastus lateralis, vastus medialis, and vastus intermedialis below the rectus femoris muscle. At the back, your hamstrings have got three muscles: your bicep femoris, semitendinosus and semimembranosus muscle. Your side has your iliotibial band and your your tensor fascia latae muscles that are on the side as well. Your hip extension muscles, piriformis, gemelli, obturator and quadratus femoris. Your psoas and iliopsoas muscle, which is your hip flexors. Your transverse here, your rectus abdominis, and below that your transverse abdominis muscles, and on the side your oblique muscles. And those are the muscles of your lower body. Thank you.